I'm Ron Boben.
I'm Marian Boben.
In January of 2002, I was diagnosed with chronic lymphocytic leukemia.
We found out that it had transformed into Hodgkin's lymphoma, a rare and very aggressive form of lymphoma. I, being a nurse, was, of course, terrified of what that meant, and our physician said we would have to seek treatment at a university-level center, which is what led us to Temple's bone marrow transplant unit.
After I had started my second round of chemo, he had informed me that we were going to be going through this stem cell transplant. I trusted the doctor, and his recommendation was Temple.
Large enough to know that the research was there and we saw the best that could be offered to us for his diagnosis, but like small enough to not feel like just another number, just another patient in a big university center. The thing that sticks out in my mind most was like I said, I'm a nurse, but the overwhelming sense of security and peace and confidence. The plan was laid out for us. Social worker met with us, showed us a binder of things, how we would go through each step. Not only that, but just their attitude was, this is doable, you're in good hands. I've never felt more secure or safer with putting him in somebody else's hands. It just felt right, felt like home, felt like confidence.
And at that time, I needed somebody to kind of reassure me that this was possible, this was doable. They were going to get me through it. And they lived up to their end of the bargain. When I was first told that I was going to have the transplant, and didn't know exactly what was going to go on. They were so understanding through the whole process.
Whenever I had a question, I could call, and they were quick to answer.
I know they have a tough job because there's a lot of people who come in who are very ill, and I think the fact that they deal with this and that they're professional, but yet they're upbeat is kind of reassuring for the patient and the family going through, because a lot of times it's people concentrate on the patient, and whether it's the wife or husband of the patient or the children of the patient, sometimes it's tougher on them.
I felt very good going home at night knowing they would take good care of them. Some of the nurses would come in and sit and watch sports with them, get him ice cream whenever he wanted. Kept him very comfortable, would tend to anything he needed. But more than that, the relationship with the nurses, when he was scared, they would talk to him. When he needed information, they would talk to him. I really, as a nurse, I keep saying this to whoever will listen to me, as a nurse, I never felt prouder of being a nurse than being with those folks. And it was like, yeah, this is good. I'd been so scared. I spent 8 or 9 years being scared of what was going to happen. How was it going to happen? What was this going to be like? And I'm not scared anymore. I left scared behind. I feel like he's in the best place possible, and we're getting the best medical care and emotional care and support that we possibly could. I wouldn't have gone anywhere else.
I was the one that kept thinking, oh, well, I'm not going to get sick. I'm not going to lose my hair. I'm not going to do this. I'm not going to do that. And the nurses would say, yes, you are. And they were right, right down the line. I mean, they knew their job. Whatever they said was going to happen, happened. It was comforting to know that they had a sense of the situation, and that their explanations really helped me through.
They prepared you for everything that happened.
Yeah, I was prepared for anything that came up. I got to the point where I started to, I almost started to understand what they were telling me. It is a scary experience because it's not something that a lot of people are familiar with. You're not familiar with a stem cell transplant. You hear it on the news and bone marrow transplants, but you don't really know. And that was probably the toughest thing was not knowing. It was really important that, you know, that they went through this various stages. And the binder was excellent. I still go back and forth using the binder. And the orientation, about 3 weeks prior to coming in was excellent. To be on the floor, you know, and it's intimidating. I mean, hospitals are intimidating. But the fact that we got to meet the social worker, see the setting, see what we were going to be dealing with, was also a good experience.
Also the orientation, we got to meet other patients and everyone got to tell a little bit of their story. The feeling of we're not alone, there's other people going through this.
I felt like I've been through a lot, and you know, I don't know how tough it makes you, but you know, the fact that I've gone through it, I'm just, you know, they always say you do one day at a time. You know, it's pretty much what it is. You know that you've gotten this far, and a lot of people have gotten you this far. So I'm just kind of, you know, happy to have my life back, and
do the simple things.
Yeah, simple things. Yeah.
Everything just seems lighter and.
Yeah, and you appreciate things.
We know whatever happens, they have it under control. And for me, like I said, I'm not afraid anymore. I know they have it under control. You know, it's a whole new lease on life. Because we were so impressed with the whole process here at Temple, and I just can't emphasize enough that they alleviated our fears, our concerns, and I wouldn't recommend any place else, and I'm a nurse, so I would not recommend it, you know, any other place.
Yeah, having been through this, you know, I couldn't imagine any place else.